A two-day consultation aimed at facilitating the development of national food-based dietary guidelines for Antigua and Barbuda began on Tuesday at the City View Hotel. Various ministries and organizations, to include the Ministry of Health and Agriculture, the Mount St. John's Medical Center, among others, are engaged in the interactive forum. Azara Lavier has the details.
The main objectives of the workshop are to discuss implications of health and nutrition situation in Antigua and Barbuda and to set national goals. Chief Nutrition Officer Juanita James says the development of the food-based dietary guidelines for the Twin Islands state has been in the pipeline for some time now.
Some time ago, in 1992 actually, there was an international conference on nutrition in Rome, jointly held by the Food and Agriculture Organization and the World Health Organization. And one of the decisions made in that conference was that we needed to strengthen efforts to promote appropriate diets and healthy lifestyle. And of course, this was in the context of the increase in nutrition-related, especially on non-communicable chronic diseases, such as the diabetes, the heart disease, the cancers, the high blood pressure. And one of the strategies that was identified for doing this was the development of food-based dietary guidelines. And what simply put, these food-based dietary guidelines are really using scientific information and translating that into simple enough language that the man on the street, that everybody can understand.
Food and Agriculture representative of Rome, Carmen Dardano, gives an overview of the project.
A fundamental goal of the FAO Food and Agriculture Organization or the United Nations is assist the countries of the Caribbean in developing national strategy, methods, and tools to improve diet. Food-based dietary guidelines are key sources of information that government can use for educating the public on ways to do this, using language and symbols that the average person can understand. The food-based dietary guidelines provide relevant dietary advice for preventing common diet-related health and nutrition problems, as Juanita said before. What we're trying to do with the dietary guidelines is translate the science in nutrition in a way that the population can understand how is a healthy diet.
Chief Medical Officer Dr. Rhonda Seeley Thomas was also present. She says the establishment of the food-based dietary guidelines are critical strategies that the country will use to assist in the development of national programs, methods, and tools to improve diets.
They can be used to offer practical advice to nutritionists and others working in related fields for producing information for the general public that is easy to use. These, in turn, will assist persons in making healthy food choices that can reduce the impact of chronic non-communicable diseases.
The workshop will conclude on Wednesday. Azara Lavier, ABS News.